So 1901 is an orally active selective estrogen receptor degrader, and we're really excited about being here at the San Antonio Breast Cancer Symposium to present some new data that we think is very exciting, which explains the emerging profile of 1901. So some of the key highlights are new data from preclinical models that assess the efficacy of 1901 both as a single agent therapy. So one of the models that we've used is to look at patient-derived xenografts. These are really important models because they are tumors that are derived from patients, and so they really represent the heterogeneity of the disease that's seen clinically. So in these patient-derived xenografts, we see great single-agent efficacy of 1901 with marked anti-tumor activity. What's particularly interesting about some of these patient-derived xenografts is that many of them have developed insensitivity or resistance to other hormonal treatments. So for example, some of them are insensitive to fulvestrant treatment. Even in the setting of insensitivity or resistance to fulvestrant, we see good anti-tumor efficacy with 1901. We're also frequently asked about the efficacy of 1901 in the presence of ESR1 mutations. Obviously, significance of ESR1 mutations in the development of breast cancer has become very well appreciated. ESR1 mutations are frequently associated with resistance to endocrine agents. In those models, patient-derived xenografts that carry ESR1 mutations, such as the Y537S mutation, that are resistant or insensitive to treatments such as fulvestrant, we still see good anti-tumor activity of 1901 with marked tumor regression. So we're really very excited about that data. We're frequently asked about the ability of 1901 to degrade the estrogen receptor. When we look in the tumor models, after multiple days of treatment, we see very marked and complete degradation of the estrogen receptor. This is associated with a prolonged suppression of the progesterone receptor as well, and this correlates with the anti-tumor activity. So we're also excited about the opportunity to be at this meeting to present some of the emerging clinical profile for 1901. So we're here to present some new data on a completed maximum tolerated dose study. This was a study conducted with 1901 in healthy volunteers, looking at an escalation of 1901 doses with administration over once daily over 7 days. What we found from this study is that in escalating from 200 milligrams, the starting dose, up to 1,000 milligrams once daily, we did not see any DLTs, and in fact the maximum tolerated dose was not determined. As a sub-study within this healthy volunteer clinical study, we used FES PET imaging to assess estrogen receptor engagement with 1901, and the results are very interesting. In looking at the two lowest dose levels, 200 milligrams and 500 milligrams, with FES PET conducted at baseline, and after 6 days of once daily treatment, we see complete attenuation of the estrogen receptor signal following 1901 administration. So I think a very important pharmacodynamic demonstration of receptor engagement by 1901. We're also here at this meeting to present an update on our ongoing phase 1 study in patients with ER-positive, HER2-negative breast cancer. And we're very encouraged by the progress in this study and looking forward to the opportunity to sharing some of the details for that ongoing clinical study. I think one of the really exciting things about this meeting has been the interest in the potential of combination therapies for treating metastatic breast cancer. There's clearly a lot of interest in finding what are the right agents to combine to treat this disease. We've been very interested in actually looking at the potential of combining 1901 with other targeted agents. And in fact, in some preclinical models, and this is data that we'll be presenting at this symposium, we've looked at the potential of combining 1901 with a CDK4/6 inhibitor. What we find is that the combination of 1901 plus a CDK4/6 inhibitor has greater efficacy than a combination of either monotherapy, but also the combination of a CDK4/6 inhibitor with fulvestrant. So we think this is a very encouraging data that demonstrates the potential of being able to combine 1901 with other targeted agents.